Welcome to the all viewers and well-wishers of the world. The purpose of my lecture is learn the knowledge from the word, return the knowledge to the word. Motto of my life is learn, earn and return. I have learned a lot, earned a lot. Now it's the time to return a lot. The topic of today is folliculitis. Folliculitis, as one can see between the hairs, the pimple-like inflamed follicles, tiny hairs, and one can see the yellow pointed lesions, which are the folliculitis. And again, one can see on the head and on the different skin, these are all the folliculitis pictures. So introduction of the folliculitis is that it is an infection and inflammation of one or more hair follicles. It occurs anywhere on the hair covered skin and it is caused by bacterial, fungal, parasitic or the viral infection. Rash appears as small and bumps or the pimples with white tips around hair follicles, pockets from which each hair grows. It is found on face, chest, back, arms, legs, buttock or head, but mostly on the hair covered skin. As one can see, the hair follicle and the hair coming out from that follicle, and one can see the pus in the follicle, and that hair follicle completely is being filled with the pus. And here again one can see the normal healthy hair and no pus in that, but here it is the infection from the skin that goes into the hair follicles and that gives you the appearance of the pus in the hair follicle as it is here. So that is infected hair follicle which is causing all this folliculitis. Acne can involve infection and inflammation of some hair follicle also, but it is not called true folliculitis. This term is reserved for the infected and inflamed hair follicles with cause other than acne. So the infection spread and turns into non-healing crusty sores. The condition is itchy, sore, and embarrassing. Severe infection cause permanent hair loss and scarring on the skin, which is affected. Mild cases clear in few days automatically. Here it is the classical picture of the folliculitis. One can see the pus-filled pimples with yellow color in between the hairs, and here again the hairy area showing the different folliculitis. Causes: follicles can occur anywhere on the body except palm, soles, lips, and mucous membrane. Why? Because that is non-hairy area. But these are densest on the scalp, again because of the dense population of hair follicles on the scalp. Most carbuncles, boils, and folliculitis are infected with Staphylococcus aureus. Folliculitis starts with introduction of the skin pathogen to a hair follicle, as I have shown you in the previous slide. Hair follicles are damaged by the friction from the clothing and insect bite, and that all causes the blockage of follicle. Shaving or very tight braid close to the scalp also cause this. The damaged follicles are then infected by Staphylococcus species bacteria, and iron deficiency has some role that it predisposed to the folliculitis. So the cause: folliculitis is caused by the bacteria, viruses, fungi, mites, and non-infectious causes like inflammation from the ingrown hairs which turn inside to the skin and follicles. Sorry, I missed your call. I took too long to answer your call. It was dancing to the ringtone. it means we are appreciating the ringtone of any person and we started dancing and ignored the call and missed the call. So the first cause is the bacterial cause, that is because of number one, Staphylococcus aureus folliculitis, hot tub folliculitis by Pseudomonas aeruginosa bacteria, Psychosis vulgaris, Psychosis barbae, or barber itch is a Staphylococcus infection of the hair follicles. In bearded area of the face, usually the upper lip, it is seen there. Shaving aggravates the condition, so that is Psychosis vulgaris. The other type is gram-negative folliculitis. It has been seen after prolonged active treatment with the antibiotic, that is the gram-negative folliculitis. And here one can see the bacterial folliculitis, Psychosis vulgaris, and the other types one can see the hot tub folliculitis and the gram-negative folliculitis in the beard because of the treatment. The other type is the viral type, that is herpetic folliculitis, rarely by the herpes simplex virus, that is seen mostly around the mouth. The next type is fungal infection, that is the tinea barbae, is similar to the barber itch, but infection is caused by the fungus, which is T. rubrum, Trichophyton rubrum. Then same fungal type is the Malassezia folliculitis, or called Pityrosporum folliculitis. It is called by the yeast, that is Malassezia. Then certain mites, next type, are responsible. Demodex folliculitis, by an overgrowth of the Demodex folliculum, a mite that lives in the human hair follicle, that can also cause the folliculitis, particularly in people with the oily scalp. Here one can see the pus filled, perfectly round in shape, and here in the middle of the follicles. So that is the folliculitis. Now between follicular difference between the folliculitis and the herpes, one can see that it is mostly around the mouth. Then the tinea barbae, that is in the bearded area. Then Malassezia folliculitis, that is a fungal infection. And then the mite which is causing this, that is Demodecosis, because of this mite which lives in the hair follicles and causes the folliculitis. The next type is non-infectious type, that is number one, pseudofolliculitis barbae, when the hair curves back into the skin and causes the inflammation. The number two is eosinophilic folliculitis, seen in the person with impaired immune system, and folliculitis decalvans, or the tufted folliculitis that affects the scalp. Several hairs arise from the same hair follicle, and scarring and the permanent hair loss may be seen. The cause is unknown. Here one can see folliculitis barbae in the darker skin and in the lighter skin, and eosinophilic folliculitis that can be seen on the face, and then treating the scarring alopecia folliculitis decalvans. And while do go for treating the alopecia, one can have this kind of folliculitis. Continuing the non-infectious folliculitis, the folliculitis keloidalis, scarring on the nape of the neck, mostly among the male with curly hairs. Then oil folliculitis, it is the inflammation of the hair follicle due to the exposure to the various kind of the mineral or the commercial oils seen on the forearm or the thighs of the patient, common in the refinery workers, road workers, mechanics, and the sheep shearers. Even makeup may cause this kind of folliculitis. The oil folliculitis malignancy may be represented by the recalcitrant cases. And here one can see acne coloidalis, and the oil folliculitis on the arm and on the legs seen. So the certain risk factor in which the folliculitis can be mostly seen. Anyone can develop folliculitis, but mostly in medical condition like diabetes, chronic leukemia, and HIV or the AIDS patient are more prone to have this. The patient having acne or the dermatitis, and the persons, those taking steroid creams or the long-term antibiotic therapy for the acne, they are also very prone. Being a male with the curly hairs who shaves and regularly wearing clothing that traps heat and sweat, such as the rubber gloves or the high boots, that also predispose folliculitis. Soaking is not well maintained. Hot tub folliculitis can be the cause, causing damage to the hair follicle by shaving, waxing, or wearing too tight clothes. These are all the risk factors which are predisposing to the folliculitis. Now, sign and symptoms of the folliculitis are clusters of the small red bumps or white-headed pimples are seen that develop around the hair follicle because it is the disease of the hair follicle. So the pus-filled blisters that break open and crust over itchy, burning skin, painful, tender skin, and sometimes a large swollen bump or the mass is formed because of this. As one can see the different symptom and the different presentation on the legs causing the pain, itchiness, redness, and the other symptom of folliculitis. So the complication which can occur because of folliculitis are cellulitis, that is infection spread under the skin, abscess, the pus formation in a cavity, recurrent or the spreading infection, boils under the skin, that is called furunculosis, permanent skin damage such as scarring or the dark spot, destruction of the hair follicles, and the permanent hair loss are all the complications of